We always look forward to spending some time with our good friend from Mercy Health, Dr. Dennis Norem, discussing what's the current state of COVID-19 and what's going on around the country, what he's picked up and gleaned, and any questions we might have as well. Dr. Norem, good morning to you.
Good morning to you guys.
How's everything going this morning?
So far, so good. As you said, quite a nice weather out there today.
Yeah, this is the kind of weather you look forward to, and we're not scorching. You might actually give your air conditioner a break. So enjoy all that. Hey, big news this morning: Texas dog, first animal in the state confirmed to have COVID-19.
Oh boy.
I'm not sure the significance of that. I guess you have to social distance from your dogs. I don't know.
Yeah, the dog is one of 12 animals in America, including one lion and one tiger, to test positive for COVID-19, according to the U.S. Department of Agriculture. The animals mainly got sick after coming into close contact with people who had COVID-19, according to the CDC. On their website, even though a handful of animals have been reported to be infected with the virus, the CDC has stated on its website the risk of animals spreading COVID-19 to people is considered to be very low. At this time, there is no evidence that animals play a significant role in spreading the virus that causes COVID-19.
Yeah, I think that was probably established several months back, that the animals can, on rare occasions, catch COVID-19, but the chances of spreading it to anybody human is probably minimal, and you have to believe that's true with the millions of cases in the world. We really haven't seen much in terms of animals, just these handful of cases.
The CDC simply says, until we know more, people sick with COVID-19 should avoid contact with pets and other animals. You should avoid petting, snuggling, being kissed or licked, sharing food, or sleeping in the same bed. Good luck.
Yeah, good luck with that.
We're kind of joking about it, but is it significant that a virus can jump species? We think. This is how it started. The bat. It evolved and could catch us. Was this something that a further mutation of the virus, or is this something that could happen from the beginning?
It could be a mutation issue. I think there are some other examples of viruses jumping from animals to humans. The whole thing with HIV, there was that suspicion way back when that might have started in animals and mutated and became a more desirable host in humans. So there is a little bit of a concern about that, but I think those examples are few and far between. And again, another one of those things about COVID-19 that we just don't know. As we move along, we'll probably have a better idea down the road as we study this a little more.
Dr. Norem, one of the hot topics has been the return of kids to school, and you had no less than the American Academy of Pediatrics recommending that, quote, all policy considerations for the coming school year should start with the goal of having students physically present in school, and the policies to mitigate the spread of COVID-19 within schools have to be balanced with the known harms to kids, adolescents, and families in the community by keeping children at home.
I would agree. I think we should try our best to get kids back in school. I think we're back to doing as much as we can in terms of the social distancing and the safety. The big problem is going to be, of course, how do you keep masks on kids, especially young kids? On the other hand, there are many areas of the country where COVID-19 cases are very, very few and far between, and there's no reason that we can't do this, I think, on a local basis and decide that we can get kids back to school in most areas of the country. If there's an outbreak, if there's cases in the classroom, then they'll probably have to shut those classrooms down for a brief period of time.
Go ahead.
I was just going to say, I think we need to get our kids back in school.
Illinois Department of Public Health has got a thing up. Let's see, as of the 8th of July, total deaths in Illinois, 7,099. That was as of July 8th. Only 4 of the victims of COVID-19 were younger than the age of 20. Nationwide, deaths for children under the age of 15 total 29.
Yeah, it illustrates the fact that the young kids, even though they can be affected, rarely have serious illnesses. Now, we've mentioned in the past this hyperimmune response. It's a rare condition that occurs in a few kids, and it does cause deaths, and it's a concern. But the numbers are extremely low. So it gives us, I think, some reassurance that even if a kid contracts COVID-19, the chances of serious illness are fairly small. Obviously, the bigger concern is probably staff members and older teachers, who may have illnesses, and there'll have to be some accommodations for that.
So, going back to the kids here, is it tough for them to catch it, or is it tough for the coronavirus to make them ill?
I think it's probably difficult, if you use that word for the coronavirus, to make the kids ill. It just seems like they do better, probably for a couple of reasons. They have good immune systems, even though they are susceptible to some illnesses. This one they seem to do pretty well with. So it's not clear yet why, but again, most of your children don't have the chronic illness issues that the older people have.
If a child, so then is it right to say then most children, if they do contract the coronavirus, they would be asymptomatic?
I think the majority would probably be asymptomatic or have very minor illness.
Okay, so then is a child that is asymptomatic that has it, or do they have the same effective rate of infecting other people, the R value, that adults have?
Probably not. Asymptomatic people, we've discovered, probably can pass it, but probably pass it at a much lower rate than the symptomatic people, or the people who are these hyper infectors. There seems to be adults that for some reason spew out huge amounts of the virus and seem to be the culprits in these large outbreaks. Don't seem to see that at all with kids.
Doctor, what can be made of, we're seeing a lot of different spots that are showing a spike. Florida, of course, always seemingly having a bullseye on it. Texas as well. But part of it also is that they're testing at a much higher level than a lot of other states are as well. What can we read into this?
Well, I think you can read in the fact that with increased testing, we're seeing a higher rate, no question. But I think the important statistic is hospitalizations and ICU bed rates. And clearly those states you mentioned, Texas, Florida, Arizona, have seen a spike in hospitalizations and an increase in their ICU rates. And that's probably the bigger concern than what the total number of cases are, because obviously the total number of cases, again, depend on how many people you're testing. So you'll have to watch and see. There are several hospitals I've seen in Texas that have maxed out on their ICUs, where almost half of their patients are now COVID patients, and that's a big concern.
We talk about the increased numbers, like the bulk numbers are obviously going to go up as you test more. Are our rates of infection, is that been relatively constant throughout this whole pandemic?
No, I think the rate is actually dropping, especially since we've seen more younger people becoming positive. So I think the rate overall has dropped. Now, in certain areas of the country, as we've seen these spikes, those rates clearly have gone up, which would be consistent with the fact that many more people are ill in those hot spots.
So, and I guess I'm wondering why in certain areas you're seeing a hot spot jump like that. In other spots, you're not seeing it, and there doesn't seem to be a correlation between, other than a larger population center where more people are obviously exposed to one another than in others, that you're seeing this. But the hospitalization rate, I guess the key factors that we should be looking at as to how bad certain things are getting is hospitalization rate and ICU count, right?
Yes, because clearly that's the sicker people. That's the issue with trying to keep the curve flat. You don't want to overwhelm your healthcare system. And if lots of people got sick and nobody had to be hospitalized, but they had minor illness, we wouldn't even need to have this discussion. But the fact that we saw what happened in New York, when you overwhelm your healthcare system and people literally died in the hallway, that's just something I don't think we want to see in this country.
Do we still have enough tests to go around for everybody? I just had I had a friend that went up to Michigan for the 4th of July weekend, and he came back and got himself tested. He said it took about 5 to 6 hours to get through the line, and it seemed to be understaffed, and there was concern there wasn't enough going around. Do we still have enough tests right now?
I think we have enough tests in terms of the actual tests themselves. I think the distribution system is still lacking in places. And again, that gets back to you see the cars lined up, especially in the areas that we've talked about in Texas, Florida, Arizona, because you have a hot spot, you have an outbreak, people want to be tested. It's just difficult logistically to get that many tests in one spot when you need lots of personnel to administer those tests. So it's a struggle. We're still not where we need to be and able to accommodate that kind of testing.
For people who have had this question, I had somebody ask me this the other day. Should I go out and get a COVID-19 test? And my response was, do you not feel well? Did something seem off? Well, no, I feel fine and all that. But is it something that I should know? Should I get myself a test just so I know? What's the recommendation on the medical community on this?
Well, I think we in this community, I think we have adequate testing right now because we're not a hot spot. Things are fairly well controlled here so far. So I recommend anybody get a test if they have symptoms of any kind that sound like COVID, or if they're concerned about being exposed to someone who has COVID. That's important to know. If they're just worrying that they might have COVID, you probably don't really need to get a test.
Doc, let's move into a fantasy world here for a second. Let's assume that we get a vaccine for this tomorrow. How does the distribution of that work? How long would it take? Would we have a drive-through situation? Would I need to make an appointment with my doctor to get it? Is there a list of who gets to have it first? What would be the rollout plan for a vaccine?
Boy, that's a good question. I don't know for sure. I know that it would be prioritized to healthcare workers and people who are high risk. So you would probably start with, again, the healthcare workers, populations, nursing homes, and people with chronic illnesses, and it would be prioritized to them. As it became more available and was rolled out, then you would have probably drive-through, public health department, make access available to anyone. But that's yet to be determined, and I'm a little concerned as we've struggled with the COVID testing. It's going to be a struggle coming up with a system across this country to try to vaccinate 300 plus million people. Yeah,
so I'm definitely not going to hold you to this answer at all, but your best guess, if we got the vaccine tomorrow, are we vaccinated as a country by Christmas? Are we vaccinated by a country by next 4th of July? What kind of time frame are we looking at?
Well, I think based on what the companies are saying, that they can make 100 million vaccines within a period of 3 or 4 months, you could probably accomplish the vaccination within a time frame of 3 to 4 months. If you could do the logistics and the personnel and all those other things would fall into place.
And of course, go ahead.
Manufacturing is probably the least of the problems. It's probably the logistics and the personnel.
Yeah, I was going to say, okay, well, we've got warehouses full of this stuff. Now, what do we do about getting it in people's arms?
Yes.
And I would imagine that there, as always, there's going to be a certain portion of the population that's going to go, nope, not doing this, not going to take part in this. And you start to make something like this mandatory, then things get a little dicey.
Absolutely. And there's going to be people that are going to refuse, as they refuse all immunizations. So that creates the additional problem of what do you do? What do you do with, for instance, we talked about opening schools. Obviously, you would want to get all those kids vaccinated, as we have vaccination requirements for other illnesses currently. And I think we would want to make it mandatory for COVID-19. So that'll get into some sticky issues I'm sure, politically as we move forward.
We're learning new stuff about this every day. It seems like I read a story last week that herd immunity might not be a possibility for COVID-19. Is that something you've heard too?
I've seen that too. It really depends on how long this virus is around. As we've talked in the past, we probably need somewhere in the neighborhood of 60, 70% exposure of the virus to get herd immunity. Well, that, by the rate we're going, that could take, let's see, we've had, in the U.S., we've had 3 million cases. We guess that maybe there's probably 2 to 3 times that number of people who've been exposed, but you're only looking at, 10 million people out of 330 who've probably been exposed. Well, at this rate, it could take years for us to get herd immunity. And hopefully this virus, we'll get it treated, or we'll get it under control, or maybe it'll go away within that time frame. So herd immunity may not be our answer.
All right. Well, as always, very interesting and very informative. Dr. Norem, thanks as always for taking time out of your busy schedule to kick this around with us. You've been with us for quite a while on this one, and we appreciate the ongoing appearances. Get together again next Monday?
Sounds good, Riley.